Hi, my name is Christina Murray. I am a second degree nursing student at Villanova, and I'm going to give my presentation on the research I've done on recommendations for responsible AI implementation for nurse educators and leaders. I'm sure everyone that's listening to this has been hearing about AI countless times in the news, whether it's about Microsoft, Google, or Amazon. And so healthcare executives, specifically hospital executives, need to be aware of the different ways to implement AI and the use cases to implement AI in healthcare in order to create the biggest financial return with the lowest risk. The American Nurses Association divides AI implementation into 6 foundational needs that organizations can focus on implementing AI in order to create the biggest gains. And so the 6 foundational needs and their rationale are listed here, and the one that I'm going to focus on a lot in this presentation is documentation. The reason that I'm focusing on documentation so heavily is that I took the 6 different foundational needs and analyzed AI products that would allow these foundational needs to be met, and then I graphed them on the revenue that would be generated from these products versus the risk it takes to implement them. And then the third dimension is the bubble size, which shows the opportunity size, which is revenue minus costs. And by far, the number one area that creates the biggest revenue is for documentation. So the platform migration, specifically to Azure, creates a huge amount of revenue for a large amount of risk, shown in that top right-hand corner. But it allows the implementation of Dragon Copilot, which includes ambient listening and voice recognition, that can really help decrease that administrative burden. And so if we're focusing in on a platform migration and then implementation of Dragon Copilot, this is an example of an architecture that could get us there. So you have all of your patient data in Epic, and then you can implement Azure on top of that, connecting in Azure Data Factory the on-prem data from Epic through pipelines into cloud and then onto Databricks, where you can use ML and analytics for physicians and NPs to analyze. And then if you implement Haiku iOS and Epic, that can be allow physicians and NPs to use Dragon Copilot and reduce that documentation time. Thank you so much for listening. If you have any questions, my email is cmurra30@villanova.edu.